Last time we talked about biomedical therapies, and this time we're going to talk about psychotherapy. We're going to look at psychoanalysis, look at client-centered therapy, sometimes called humanistic therapy. We'll look at cognitive therapy, social therapies such as group therapy and family therapy, and in the next video we'll finally look at behavior therapies. So psychoanalysis, as we remember from our discussion of personality, was developed by Sigmund Freud. And even though most psychoanalysts, and a lot of them still practicing psychoanalysis, they don't rely on the tenets of Freud's theory that was psychosexual in nature. They deal more with the social conflicts, but they do deal with conflict. And the conflict is the patient has between the id and the ego and the superego. And the task of the therapy is to resolve those conflicts from childhood. And remember, the therapy is unconscious. I mean, the conflicts are unconscious. The goal of the therapist is to interpret, and then by interpreting what the patient is doing and saying, the patient gains insight, and with that insight, they can finally resolve the conflicts that occur. Abnormal behavior only symptoms of repressed unconscious conflict. That's what produces the abnormal behavior. So we have to understand those repressed unconscious conflicts in order to treat the patient in psychoanalysis. The techniques that are used by psychoanalysis are first free association, where the patient literally just free associates, comes up with everything they can possibly think about, and does it without any editing, just stream of consciousness. And it takes a long time for the patient to learn how to do that. And literally in Freud's day, the psychoanalyst would sit behind the patient when they were lying down on a couch, and so that the patient couldn't see the therapist, and they were simply speaking everything they could think of coming out of them. And that took some time to learn how to do that, to free associate without editing. They also use dream analysis. Dreams, according to psychoanalysis, have both manifest content and latent content. The manifest content is what the dream actually is about. The latent content are the reflections of this unconscious conflict that the therapist has to interpret from the dreams. An important component of psychoanalysis is transference, where over a long period of time, the patient will actually transfer their feelings about the conflict, whether positive or negative, onto the therapist. So the therapist then, once transference occurs, it's easy for the therapist to look for things that can be interpreted and help resolve the conflict that the patient is experiencing. Psychoanalysis takes a long time. Literally, in the earlier days, it took years of having therapy 3 times a week. And obviously, with paying for the therapy becomes a very important problem, because if you have that, take that much of the therapist's time, it's going to be very expensive. Now with insurance paying for mental health care, psychoanalysis has learned to do this in a somewhat shorter time, but it still takes a very long time to have transference occur and to get enough free association that you can have enough to interpret what the conflict is. The second therapy I want to talk about is client-centered therapy, or humanistic therapy, developed by a lot of the humanistic psychologists, but the primary proponent of this kind of therapy was Carl Rogers. We also talked about Carl Rogers' Rogers' theory of personality when we talked about personality. The focus is not on curing an illness, but helping the patient grow and reach self-fulfillment. Remember that the top of Maslow's hierarchy, self-fulfillment. That's what the goal of this therapy is. So the person is not ruled by unconscious forces and conflicts. They're ruled by conscious decisions, and the therapist needs to help the patient understand their decisions and understand their self and be self-fulfilled. Now, in client-centered therapy, the therapy is non-directive. The therapist is not an authority like they are in psychoanalysis. They're not there to interpret. They're there to simply help the patient understand what it is that they're dealing with. So a lot of times it's non-directive. The therapist doesn't direct. They simply repeat back what the patient is saying. In fact, there are some computer programs that actually produce client-centered therapy by simply repeating back what the patient says. And by doing that, the patient becomes more self-fulfilled. There are 3 requirements for successful therapy and client-centered therapy. We talked about these earlier when we talked about personality. Genuineness. The therapist has to be absolutely honest and open in talking with the patient. Unconditional positive regard. That is, you have to really be very positive about the patient. And then third, empathy, a feeling of understanding of what the emotions are that the patient is experiencing. Client-centered therapy, developed by Carl Rogers. Then there are cognitive therapies, and we talked about cognitive theories of personality also when we talked about personality. The goal is to change the cognition, change the thought processes. The cognitions are what are generating the abnormalities of the patient. There are 2 that I want to talk about: Albert Ellis's rational emotive therapy, and the second one is Aaron Beck's cognitive therapy. So let's look at Ellis's rational emotive therapy. What Ellis believed was that the patient is experiencing emotional responses to maladaptive, inappropriate thoughts that are, in the therapist's mind, are irrational and ridiculous. And so Ellis's therapy would actually be very confrontational with the patient, trying to point out how ridiculous their thought processes are. We need to change emotions by changing the thoughts. And the therapist changes the thoughts by pointing out how absurd their self-defeating ideas are, and pointing out that there's another way to think about what they're thinking about. So try to change their emotions by changing their thought processes. Aaron Beck's cognitive therapy was primarily for the treatment of depression. He's wanted to change thinking so they can change functioning. And that, again, the depressed person has thoughts that are very negative about themselves, and the idea is to point out that that isn't necessarily true. It's not as confrontational as Ellis's therapy, but it still wants to change thought processes. That's the goal of cognitive therapies. And then there's social therapies like group therapies. It saves a lot of time and money because you're spreading out the therapy among a group of people, so the cost is less. It also saves time of the therapist because they can deal with several people at the same time. It allows the patient to see that others have the same problems, and that's a powerful thing to understand, that you're not the only one that's experiencing the problems. Other people are doing the same. And then it also provides feedback on progress, feedback from the therapist, but also feedback from the other people in the group. So it's good at doing that. And there's authoritative pressure from the therapist, but there's also social pressure from the other people in the group. So group therapy is often very effective, especially in today's times where cost is such an important factor. Another kind of social therapy is family therapy, where you deal with the family or the husband and the wife, couple therapy. And what you're trying to do there is reconcile the two, the husband and the wife, or the family, if it's a family therapy, to reconcile the situation among the members of that family or a couple. Well, the next video is going to be on behavior therapy based on learning theory. Thank you.